12:05, and we can start our webinar today on the role of artificial intelligence. I will give immediately the floor to our director, Alexis Gusdil. Alexis, the floor is yours. Thank you.
Thank you very much, Marika. Good morning or hello, everyone. I'm very pleased to welcome you today. It's a very exciting experience since we launched the EMCDDA webinars, and I want to welcome all the participants with special thanks to those who are our more loyal clients and customers. We have two very distinguished speakers today, and also two very talented EMCDDA staff as the chairs or co-chairs. I want to welcome Vivianne from the Campbell collaboration, and Hermano from our sister agency, the European Food Safety Authority. Today we have a very interesting topic. First of all, because there is a lot of discussion and debate about artificial intelligence, and it gives me sometimes the impression that every time that there is a new wave of new things or potentially important development or technological development, there is always a moment of panic, and with a lot of opinions and exaggeration. And sometimes we don't even realize that part of this technological innovation is we already use it without knowing it. And I think there are plenty of services and applications we use in our PCs or laptops or on our telephones that are using artificial intelligence. We are not just aware of it, and it's not necessarily a disaster. And then, of course, in the news, in the media, in the last 12 months or 18 months, there were many declarations, including from some of those who have financed and pushed the development of for instance, the large language models. And suddenly the people who have developed those things come back with a different opinion and talking about a permanent danger and we should avoid. I think it's partly exaggerated. I don't think that technological evolution is necessarily or automatically good or bad, or certainly not good or bad for the humanity. The truth is that every time that there have been significant technological change, but the industrial revolution was also a kind of a technological change. Obviously, the industrial revolution has brought a lot of changes, some of them positive for some human beings with a different impact, sometimes negative for others. The evolution of IT and IT systems, I think it has brought a lot of good things to us. And I think the same for artificial intelligence, especially combined with other tools and different modalities such as big data. Just to give you one illustration that has nothing to do with our core business at the EMCDDA. If you look at the research that is made internationally, which means including in the European Union, on cancer, using the images from nuclear magnetic resonance, or the fact that very serious studies have shown that today you have expert programs, that make less mistakes than human beings, doctors, when they analyze an echography or a radiography. I think obviously we can only welcome the development of tools that will help reduce the mistakes, identify at an earlier stage, maybe one day, which is the proportion, for instance, of cells that have a tumor that could turn into a prostate cancer. Because for the moment, only 10% of men who have had a surgery are considered that they would have developed a real cancer later. So everything we can do to better provide service to our citizens is extremely important. Now, how people are using them, that's a different story. what is the training, what is the education that we need to have in order to make use of those tools? That's another story. And I think we should not be naive or ingenuous. There is certainly a potential for change in work and work conditions. So it certainly means that some tasks that are more routine or that are done by people with less qualification, some of them may disappear. So this means we need to find new profile, new job, new opportunities for those who may see their work becoming less relevant. But it doesn't mean that those people need to become or will automatically become useless or jobless. So I think the importance about technology is what it allows us to do and what also we decide to do, how we control the use of those tools. And I think today with the two speakers, we have two very exciting, at least for me, very exciting opportunities to learn. This is why I've not planned to make any conclusions because out of those who are on the screen for the moment, I'm the least competent for that. So I will count on Bruno and Gregorio to share their own conclusions with us. But I think with the experience of Vivianne and Hermano, you will learn about plenty of things for which it's amplifying our capacity to do things. It can be our capacity to take decisions, our capacity to analyze or to detect or to be aware of new findings in scientific research or to identify gaps. And also it's all the work done by the Food Safety Authority to support the work of that extremely important agency, as it is about our food. It is about possible dangers, but also new opportunities and about the health of everyone. So I look forward to learn from those experiences. And also I'm very curious to see what are the questions that they will receive and how they are going to answer to those questions. And we at the level of the EMCDDA, we have a strong interest and relatively low experience in the use of artificial intelligence. We use already. Certainly, we want to learn. We want to learn also from other agencies who have made bigger investments already. But certainly, this is part of the way we can work together and achieve our goals and fulfill our mission, especially our new mission as the future European Drugs Agency. So thank you, and I'm really looking forward to a very exciting webinar.
Thank you very much, Alexis. I would like to echo what you said and give a warm welcome to Vivianne and Hermano. I will like to make a brief presentation on each of them in case you don't know them. Vivianne, Dr. Vivianne Welch, is an editor-in-chief of the Campbell collaboration. She's also a senior investigator at the Bruyère Research Institute and also an associate professor at the University of Ottawa School of Epidemiology and Public Health. And today she will speak about the use of machine learning and AI in Campbell systematic reviews. And on the other hand, we have Hermano Cavalli, which is a senior data scientist at the European Food Safety Authority, EFSA, our colleague agency. And he's leading an introduction of artificial intelligence in core-specific process as evidence management. He has a total of 40 years of experience in the area of information technology, and he has covered, prior to EFSA, managerial roles in Siemens Mobile and Olivetti. He will speak today about recent advancements in AI at his agency, EFSA. I would like to continue the session, opening the first question. I will pass later the floor to my colleague Bruno for the second question, but for this question, I would like to open it up for our guests, Vivianne and Hermano. First of all, what is the current use of AI in evidence-based research? And what are the main opportunities and challenges of AI use for systematic reviews and evidence synthesis? I will give first the floor to Vivianne, which, as far as I understand, she has prepared some presentations, and then we will go ahead and see what Hermano has to say about this. So Vivianne, the floor is all yours. Thank you very much.
Sorry, I have to unmute first. Wonderful. Thank you, Gregorio. Thank you, Alexis. And thank you to EMCDDA for the invitation to be here. The sound is okay, Gregorio?
Perfectly. We hear you fantastically. Thank you, Vivianne.
Okay, great. So I prepared a few slides about what is Campbell and what are the challenges and opportunities of artificial intelligence and machine learning for the Campbell collaboration. Won't take me very long because I know this is meant to be more of a panel. So let me just see if I can control my slides. I don't think so yet. Ah, there. Okay, so I just want to give a bit background about what we are, why AI machine learning is so important for Campbell, how machine learning and artificial intelligence can be used in evidence synthesis, and what the challenges, opportunities are. And then just a little bit of what we're doing currently in this space. So we are actually a USA registered not-for-profit organization, which is global in nature, and we promote the production and use of systematic reviews to inform social policy. 2 years ago, we made the decision as an organization to focus very much on promoting use of rigorous evidence synthesis, not just on producing synthesis. And to do that, we work with policy partners. So we also publish a journal that is the home of systematic reviews, published under the with Campbell. And this journal just received its first impact factor last year. It's open access and free to publish. And we publish systematic reviews, but also other types of evidence synthesis. So we publish evidence and gap maps. We publish methods research as well. And I think the range of topics illustrates some of the challenges with using artificial intelligence and machine learning. So we cover social policy areas that are on this slide, from aging, business and management, climate solutions, crime and justice, education. Maybe of most interest to this group, we have a group on social welfare and a new group on substance use treatment and recovery. Many of our reviews look at multi-component interventions that cross disciplines and sectors. And we've continually grown in the number of publications, but not exponentially. And I think that I'll come back to that later. We have an increasingly global network of contributors. This map 5 years ago probably would have been mostly Canada, the US, UK, and Australia. So we've experienced growth in China, India, Africa especially. So I think when it comes to why AI, we've embedded the use of AI and technology in our strategy. And this is our strategy to 2025. We have 5 main areas of focus. We want our reviews to be relevant to users. We want to promote open science so that people can share and reuse the data from our reviews. We want to see AI move from really the technology to quality assurance, products that people can use, and then implementation or deployment. And we'd like to, support methods and process innovation. And I think on the AI side, what we see in evidence synthesis, and some of you who work in evidence synthesis, and maybe Hermano will touch on this, is there are many tools available. They've been developed for specific parts of evidence synthesis or applied in case studies. But what we need is to partner the applied people like me who are doing reviews with people who understand the tech to develop, user-friendly tools that do what's needed. And I think one of the big cases for Campbell as to why we'd like to see more use and testing development of artificial intelligence and machine learning for reviews is, imagine you could map all the evidence in the topic area you're interested in a matter of weeks. So this is map that was developed by James Thomas at the Epicenter in collaboration with Campbell and the American Institutes of Research. And it was entirely populated using machine learning and AI in the period of about 5 weeks. And we're currently, the Epicenter is currently testing and validating the assessments made by the coding framework. So I wanted to give just an idea, and this might help to elaborate some of what's going on in artificial intelligence, is how is AI and machine learning being used in evidence synthesis? And this is a diagram from actually Campbell's training materials that is available open access from Carnegie Mellon, and shows the steps of doing reviews. But actually, all these steps have opportunities to use AI. So in problem formulation, there's software that's been developed by the accelerator for systematic reviews by Paul Glasio to help write the eligibility criteria in question on the basis of team brainstorming. There are tools for searching the literature like LitSearchR, tools for translating literature searches. Screening is probably the most used application of machine learning in systematic reviews right now, where there are tools that learn on the basis of human coding and then prioritize the screening results. Data extraction, coding, there are tools for critical appraisal, and tools for updating. The Epicenter has simulated that using machine learning for updating reviews, you could keep a review up to date by screening about 100 articles a month. So there are lots of tools. So I checked how common is AI and machine learning in Campbell reviews, and about 27 out of 259 reviews mention artificial intelligence or machine learning or automation. So this is one of my fourth baby. It's like baby steps for Campbell in using systematic reviews. Although 27 out of 259, if we think of the most recent years, that's probably about a quarter of our reviews published in the last 3 or 4 years are using machine learning. And that's only the ones that are describing what they're doing. So some of the challenges, I thought I'd start with the opportunities, and I wanted to convey the idea of going fast. So I went through my photo album, and this is one my father took in 1961, probably. This was the E-type Jaguar that could go 150 miles per hour. So I think this is one of the opportunities for Campbell. We want to see reviews done more quickly, but also at high quality. There are various studies that show that using machine learning, artificial intelligence in systematic reviews can speed up processes by 30 to 50%. They can reduce the time of screening. And I think, Alexis, you mentioned this doesn't mean that we don't have jobs for the people who are doing that screening. It means that we have actually more time to think about the right questions to interpret the data. So speeding up automating some of these tasks can help us in other ways as well, I think. And then I think the challenge also, Alexis, you mentioned the potential for misuse. So this is my oldest daughter using 2 tools, drill and a hammer, but these tools can be misused. So for example, some people are using priority screening, but then stop screening at a certain point without testing what's being lost at the tail. And that's really quite tricky in something like a Campbell review, which has, complex interventions and multi-component interventions. There might be a systematic loss of certain types of interventions or certain populations from the studies using those types of cutoffs. And then secondly, if those cutoffs are used, we need to know how they were validated. And this is not often reported in systematic reviews. And I think the third thing, Alexis, you touched on this also, is the potential for bias in the training data sets. And I was looking through my photos. I don't have any great photos, but this cartoon showed up in my photos that, 15 years ago, something in the sky with a child might have been a kite, but now it's a drone. So when we look at how we train machine learning, we need to think about the training data sets being appropriate for the questions. And there could be a risk of exacerbating inequity. So we do need a lot more testing. So what is Campbell doing? So we are, small not-for-profit, and we see a huge opportunity for AI. We want to get on board with testing and developing technology that can support people publishing with us. So there are two main things we're doing. Is working with others. So this was my best photo of collaboration. I think my son and niece are making pancake batter here, but we're working with others to provide. We bring the use case, what we need machine learning, artificial intelligence to do, and we work with partners who provide the technology. So Campbell is providing some support to the International Collaboration for Automation Systematic Reviews that is sometimes called ICSR. And we're working to develop standards to evaluate the technology, but also working to make the case for funding to support that technology and development. And then thirdly, we don't want to stop authors from using AI. We want to encourage them to use tools to report what they do transparently. And I think the last thing we're doing is building an early career network where we expect that AI will feature really prominently in the topics that early career researchers want to talk about. This is an image of two of my kids doing hands-on museum learning about water. But this is the opportunities of early career researcher networks, is to build those peer-to-peer collaborations, but also collaborations with leaders in Campbell who are experimenting with AI. And I think that's it. One of the first things that we're doing in AI is working with the partners of the Global Evidence Summit, Cochrane, JBI, Guidelines International, to develop these standards for evaluation and what standards are needed to test and develop new tools for systematic reviews. I'll stop there. Thanks.
Thank you so much, Vivianne, for the excellent presentation. It was super interesting. I particularly liked when you mentioned some of the challenges that, of course, with machine learning, you're working faster, 25% faster, and that this automation might be a threat for some people because they might feel that their jobs might change. But you mentioned that actually this faster working means that there's actually more time to focus on other things of the job, like processing and understanding what's actually happening. So I really like that. And as well, what you mentioned, the challenges related to the misuse of existing tools. I think this is a big challenge nowadays. So thank you very much, Vivianne. I would like now to give the floor to Hermano. Do you want me to repeat the questions? Maybe we can put the slides briefly again, Ale, so that the questions are there again on the screen, if that's possible. Well, oh, perfect. Fantastic. So, Hermano, again, I repeat the questions. What is the current use of AI in evidence-based research? And what are the main opportunities and challenges of AI use for systematic reviews and evidence synthesis? Thank you, and the floor is all yours, Hermano. Hermano, I think we cannot hear you right now. Perhaps you're muted.
Yeah, I was muted, yes. Can you hear me now?
Yeah. Fantastic. There you go.
Yeah.
Thank you.
Yeah. Good afternoon, and thank you very much for having invited me here. It's a very interesting, it will be a very interesting discussion because we didn't align with Vivianne before this presentation, but I've seen we have a lot of points in common. Then there are a lot of activities we are also doing in parallel. I work for the European Food Safety Authority, that is a sister agency, is an agency of the European Commission, same as EMCDDA is. And we at EFSA, we strongly believe AI will give a lot of opportunities to us, but will also take a lot of our resources to be implemented. No? So that is why 3 years ago, we have founded the UAI virtual community between different European agencies to share all the knowledge we are developing on AI. And I've been one of the founders of the community. This is a kind of initiative, the one we are doing today, that I believe, we strongly believe will be very useful in developing applications and usage of AI in all the European Union agencies. And so thank you very much again for having invited me here today. We have started applying AI experimentally a few years ago to one of the areas of evidence management in EFSA, that is systematic reviews. We call them systematic reviews, essentially. EFSA is an agency that does not produce primary research. We only use secondary evidence. So systematic reviews are one of the pillars in the way we transform evidence and we come to our scientific conclusions. The other areas are data collection of data from the member state, and the other area is what we call expert knowledge elicitation. So if we don't find evidence in literature, if we don't find evidence in the data from the member state, we go back to the experts and ask them what is the evidence they have. So this is to introduce a bit what we are doing in EFSA. Systematic reviews, as I said, is one of the three key areas, one of the pillars of evidence management in EFSA. We follow a methodology from Cochrane Collaboration, which is a parallel organization to the organization where Vivianne is working on. And our methodology is very similar. So I had also prepared one slide, but I will not use it because Vivianne has already introduced how the methodology works essentially today. Now, just to give you an idea about the magnitude of our systematic reviews, usually we are in the order of 10,000 of scientific papers that we need to analyze for each systematic review. So usually the range is from 30,000 to 60,000 scientific papers that we have to analyze. We work a lot, I personally work a lot also with another sister agencies, which is EMEA, the medicine agency, and their magnitude is usually 10 times larger. So they are oftentimes in the range of 500,000, 600,000. And because there is more research in the area of the pharmaceutical sector rather than in the food and feed sector. Why that is the case, I don't know, because we eat food every day, while drugs, we take them, medicines, we take them only when it is necessary. But for sure, the pharmaceutical sector is much more active than the food and feed sector. Anyway, usually our systematic reviews are in the range of 30 to 60,000 papers. So we have started applying AI in some areas, in some of the steps. One step where we have been very successful is what we call screening by abstract and title. I think it is also what Vivianne said, that there are a number of tools that can do the job very well of screening relevant papers, only reading the abstract and the title. It is at the very beginning of a systematic review, because you started searching all the possible papers, and then you need to restrict them. Typically, we restrict them to something like 2 orders of magnitude. No, so if typically we start with 30,000 papers, after screening by abstract and title, we have reduced them to 300. That is a typical number, comes from our empirical experience of having conducted systematic reviews in EFSA for almost 20 years. Why that number, why that pattern is recurring is still not totally clear to me. If it is because usually our working groups are made of 4 experts, so they cannot read the 30,000 papers in full. They can read maybe 300 usually. That is for sure one of the point, or if it is only because most of the paper are not relevant for that specific question. Most likely is a combination of the two factors. But with the screening by abstract and title, we reduce them by 2 orders of magnitude. And there are tools on the market that are very good at doing that. When we started this experience, I started in 2018. Most of my scientific colleagues were convinced that that task was impossible to be done by AI. AI was not so mature, I have to admit, in 2018. So it has taken some time to convince them, but we have been able to do it. So most of my colleagues now are using this kind of tool in a number of different ways they can use it. I can expand on that. So at the beginning, the question was how precise are these tools? No, so we had a lot of discussion using sensitivity, specificity, precision, recall, and if it is 85% or 90% or 95%. Now all these questions are closed. Most of the colleagues use these tools. They trust them. Some of them have also become addicted to them because when you have a tool that you push a button and it does your work for you, it is always something that you love. So a number of colleagues are using now this kind of tool in EFSA. So the question now has changed. The question also from many of our stakeholders is how do we document the decision taken by this tool? And this is the issue, the point we are tackling now, we are discussing now. I have to say that this kind of tool, being commercial tool that you buy on the market, are not very transparent. And it is always not so simple to explain the decision taken by these tools and why they have decided that some papers are relevant and some others are not. But they work, They have survived many challenges that we've done internally. So the point now is not their precision, but how we can explain the decision that they have taken. And we have a number of scientific opinions that EFSA publishes where we declare that we use AI tools for taking our decision. Okay, so this is one of the areas where we are using AI today, the screening by abstract and title in systematic reviews. There are other areas in systematic reviews. For example, one of them is the extraction of data, because even when you have decided which papers are relevant, they are still in narrative form. So you need to extract the relevant data from those papers. Data can be in text, in tables, or in graphs. There are tools that are capable of doing one of the three things, but we have not been able to find a single tool which is reliably able to do all of them. And another area we are working, we don't have a tool yet. We should be able to have one at the end of June, because we have a project going on, is the next phase, which is that we call critical appraisal, where we evaluate the risk of bias in the papers. And we know there are tools on the market, but we have worked to create our own tool based on generative AI, large language models. Because when you do risk of bias, you have a number of questions, 14 typically in a model, that are in plain language, in English, and you have to find the answer in the text of the papers. No? So that is a typical task for large language models. We are producing a tool, and it is giving very promising results. And so hopefully by end of June this year, we should be able to have a tool also for critical appraisal. If we are able to have this tool, that would take to another interesting questions. Because the area of critical appraisal is considered an area that requires a lot of expertise. No? So during this year, when I was doing my presentation about AI to the EFSA Scientific Committee, first of all, my colleagues were not convinced that it would have worked for screening by abstract and title. Then we demonstrated it could work. And so the question from my colleagues in the EFSA Scientific Committee was, how can you make it work also for critical appraisal phase? Because that requires a lot of expertise. And it seems that these large language tools are able to simulate, I would like to use the word simulate, the behavior of an expert. I don't believe these tools have become expert in life sciences, because in EFSA, essentially the disciplines are life sciences. I don't believe they have become expert, but they are very good in simulating the behavior. I don't use the term knowledge, but they are very good to simulate the behavior of an expert. So these open a very interesting point of discussion to me, that they are able also to augment the capacity of experts. I do not want to say to replace scientific experts, but they seem to prove to be very good also in augmenting the capacity of experts. So just to resume, these are some of the areas where we are using them in evidence management, systematic reviews. We have steps where they have been successful, like screening of papers, steps where they are less successful, like data extraction, steps where we believe they will be successful, like critical appraisal. So that's the situation today. And I share all the doubts that Vivianne mentioned before, like you need a training database with relevant level of quality, for example, and you need to be able, the big question mark we have today is how do we explain the decision taken by these tools? The explanation is still too complex as we see it. So this is the experience we have in EFSA, and we are willing to share it with anyone else who would be interested. Thank you.
Thank you very much, Hermano. Incredibly interesting presentation. I was really amazed about the magnitude of your systematic reviews. 100,000 papers, that's incredible. I can imagine the time difference between doing them manually back in the day and using artificial intelligence to, just for the abstract screening, you mentioned that you go from 100,000 to 300. That's incredible. And then you mentioned that the European Medicines Agency, they even use sometimes 500,000 papers. So there's definitely a very big help of AI there. I would like now to pass the floor to my co-chair, Bruno, who will take care of the second question. Thank you, Bruno.
Okay, thank you, Greg. Good morning, Vivianne. Good morning, Hermano. And thank you for participating as panelists with your very valuable and important contributions. I was also impressed by the amount of papers that you have to screen, and how you are using AI and the potential of using AI to support you in reading through all of those literature papers. I have now two questions. So, and these are specific questions to each one of you. I will start by Vivianne. And then I will ask the question to Hermano, and then at the end we open the question and answer moment. And the question to Vivianne relates to social interventions, and what are the main challenges of applying AI to systemic reviewing for the evaluation of effectiveness of social interventions? This will be the question to you, Vivianne.
Okay, I don't have a second set of slides. I think I've covered some of these challenges in my first intervention, but I think especially for social interventions, as I mentioned, they're complex and multi-component. This can be important to take into account if you are using machine learning. So one example review I was doing on skills development, employment interventions. Most of the studies were large-scale social policies. So when we use priority screening, those are the studies which were noted as more relevant. When we got to the very last articles, I don't remember how far down the pool, we found there were a lot of individual interventions for skills development that had been deprioritized by the machine learning. So I think that with our social interventions reviews, we take quite broad questions, and that's a particular challenge for machine learning because you need to train the machine on the topic the question you are asking. So this has come up also in our climate solutions group, where they have diverse types of interventions, broad questions about climate solutions. Then you need to train the training set needs to include all the topics that you think you will cover in your question, and then you can improve the efficiency of the of the machines, right? By having the right training set. I think that another challenge with social interventions is we often include non-randomized studies, and that might be Cochrane and healthcare systematic reviews do include non-randomized studies, but often they are the main type of study for our questions, because we study things like education interventions that are not randomized but are compared across different school districts. And then when you look at non-randomized interventions, doing a critical appraisal for risk of bias might be more complex. I think that's also an opportunity for machines, because you can still use the same domains of risk of bias, but you are looking for different types of information. And we actually have a non-randomized studies working group, which is, I think their paper is coming out in the next month or two about matching the domains of risk of bias. And then you can take those domains and test that, I think, with machine learning. So I think there are challenges and opportunities, two sides, right? I think maybe a third challenge, and to keep this kind of short, is that in social interventions, we are often concerned about reaching vulnerable populations and mitigating inequities. And I think we still need a lot of testing with machine learning and artificial intelligence, that we are not perpetuating existing inequities. And I'm not saying that machine learning can't be brought to the right place, but I think we need that transparency to understand and validate that they are working the way they're intended. And I think that's sort of how I concluded the activities that Campbell is doing is making the case for the kind of funding we need to consolidate and test these tools for use in social intervention reviews. So I think I'll stop there.
Okay, thank you very much. And your first challenge is actually bridging a lot with something that Mano referred to as, I would say, the black boxes, that you don't understand exactly how the model or the algorithm is making decisions, and this is really a challenge and the need for more transparency. I have now the question to Hermano, which is more on, I would say, more on a practical aspect on how can an European agency, and this is very valuable for us as well, how can an European agency improve the services to stakeholders by safely using the opportunities offered by AI? So, and this is our question to you, Hermano.
Yeah. Now, I think one of the keys here is safely, the term safely, and the usage of the trustworthy usage of AI, which is one of the priorities at the level of the European Commission. But the way we want to use AI is to address one of the priorities we have in EFSA, which is called the timeliness of risk assessment. We have had scientific opinions that have taken 4 years to come to a conclusion. Without entering into the discussion why it has taken 4 years, we strongly believe, and also the European Commission has recommended several times to EFSA to be more timely. So we want to use AI to speed up this process in a way which is safe. So where the results are good, are at least at the same level of what the experts are doing, or even better. So one of the things we want to do is to be more timely. We have also areas where there are a lot of new scientific papers that appear every year. So we want to update our scientific opinions in some areas at least once per year. So we want to use AI to automate more and more of the steps in these areas. So that's why and how we want to use AI, and also to enlarge the range of papers, scientific papers that we are able to deal with, because we have seen in the past that sometimes as the range of scientific papers was too large, we had to put some limitation or come to conclusion that were valid only in certain conditions. So these are some of the things we want to work on. About the safe usage of AI, we are having a number of discussions internally how to use AI. We have also created an AI task force recently, because we have more and more applications of AI, which is the equivalent, if you wish, of an ethical committee about the usage of AI internally, and also to address some of the points like the training database, the quality of the training database, which is very important for us. So we believe a strong step forward is the new EU AI Act, because now it has been voted by the European Parliament, so there is also text on which we can base our decisions. We work a lot together with the legal department internally in EFSA on the applications of AI, but sometimes it was difficult for them to come to a conclusion because they didn't have a law. They didn't have a written text on where to base the decision. So now is getting much better. But so we want to use AI to be faster, to be more timely in our conclusion. We want to use AI to broaden the range of evidence on which we base our conclusion, but we also want to use it in a way that is trustworthy and for the public. So, for example, one of the big questions we have to answer is, now that the EU AI Act is a law, you know that the EU AI Act classifies AI application on 4 different risk level, is where EFSA scientific opinions will be. Will they be considered high risk because we deal with health and safety of European citizens, or low risk? If an AI application will be considered high risk, there will be a number of ex ante and ex post requirements that will have to be respected. And the ex ante requirements, for example, are on the quality of the training database that is used for AI systems, no, as Vivianne said. So we believe the EU AI Act will help a lot in giving some objectives, criteria to decide if an usage of AI is safe in your terminology, or is ethical in the general terminology of the EU, of the Commission. I don't know if I replied to your question.
Yeah. Thank you very much. There are some, I would say that some bridges between also some of our needs, which relates a lot to timeliness, and this is something that we are always thinking in the how fast we can reply to our stakeholders, and I think that what you have just mentioned, it bridges a lot with also some of the needs here at the agency. Thank you very much for answering to these 2 questions. I think that we are now going to the question and answering. So there are already some questions here. So I will start by asking one question, and then my colleague Greg will ask another one, and so forth. But before go to the question and answering, I have a question that I would like to make to Hermano, which reflects also a concern from Vivianne. So you referred to some sort of a black box. So when you are applying these large language models to the systematic reviews, and you don't really understand how the algorithm makes such decision, right? But you also referred that some of these algorithms, they survive to challenges, to some of your challenges. And I would like to ask you if you can share with us 1 or 2 examples of what challenges were this, in order for you to try to understand or to try to cope with the fact that we don't really understand in some situations why the algorithm is telling you that it decided for this amount of papers.
Yeah. Now I will give you the example of our forthcoming tool to evaluate the risk of bias. No, as we have designed the tool, we have designed it in a way that the tool indicates in the text of the paper what are the sentences on which it has based its decisions. No, so the tool, for example, referring to Vivianne example, one of the usually question number one in risk of bias is if the population was adequately randomized. No, so the tool will decide if there is a risk of bias in randomization, but will also indicate on which sentences in the text of the original paper it has taken its decision. No, what are the sentences and the evidences on which the paper has used a randomized population or not. For example, that's an example of how we believe a tool should be properly designed. The tools we adopt for screening by papers and title, screening of papers by title and abstract, on the other side, is a tool that we buy. No, so we have not been able to force or convince the commercial company to show in the text of the paper on which sentences it has taken its decision. No, they insist on explaining how the AI algorithm works. It is a support vector machine, which is a statistical method. Okay, fine, but I strongly believe the explanation should be understandable by the population of the readers, and the people who evaluate papers in our domain are life scientists. They are not computer engineers. So if an explanation is given by a computer engineers, they will not understand it. It has to be understandable by life scientists. So the best example I've seen so far is to show the sentences in the text on which the tool has based its decisions.
Okay, thank you. Greg, do you want to start by asking the first question from the panel? Thank you, Hermano.
Thank you, Bruno. Absolutely. I'm going to start with the first question that we received in chronological order. A question about expertise and who is considered an expert. Is trying to simulate behavior of experts for critical appraisal not reinforcing expert biases? What about different kinds of evidence and what counts as knowledge? I leave the floor open. Vivianne, Hermano, up to you. Who answers?
Well, I guess I could just add something. Campbell had a consultation with, well, not consultation, but sort of strategy session with an AI expert 5 years ago. And one of the things he said really, I think is helpful here, that, computers do what you tell them to do. This could be a good thing or a bad thing. So you have to be very thoughtful about what you're looking for, right? So I think machine learning is very good at emulating experts because the definition is to search for information. For example, in the case about randomization, to search for information about how people are randomized. I mean, if you were looking for detection bias, then machine learning can search for the text that relates to measurement, performance, and detection bias. So I think in that sense, you can reinforce those biases about what are the domains of risk of bias that are important. But that's, I think, what I mentioned in my first talk with the slides is you need to define what it is and how you're appraising. And I think also to Hermano's point, you need to be transparent about those judgments as much as possible. So these are the things we need to develop with machine learning, artificial intelligence in systematic reviews, is how to be transparent and validate the decisions. It's a great question.
Thank you very much, Vivianne. Hermano, would you like to add anything for this question?
Well, yeah, I mean, the definition on what expertise is rather complex. From what I said, and I can also repeat it, I'm strongly convinced that these tools and even generative AI, they are not experts in a specific domain. They do not become experts in toxicology, for example. No, But they are able to simulate the conclusions of the experts in toxicology. So that is my personal point of view. There's been a famous paper, I think more or less 1 year ago, about a large language model from a US university that said that they are stochastic parrots. I'm convinced about that, but they work. From my experience, our experience, they work. And there is also, I think, another important point that what is the truth? No, when we were validating the results of our AI tools, we have the complete history of our systematic reviews done in EFSA for 20 years, we have created a statistical database, for example, on screening by title and abstract, where we have proven that usually the agreement between experts is 70%. So in the typical EFSA methodology, two experts evaluate the papers independently, and they have to say if they are relevant or not. And statistically, we have seen that there was an agreement of 70%. So what does that mean? That one of them is wrong and the other one is correct? No, that according to EFSA Scientific Committee, there is a difference in scientific opinions that is something we need to preserve. But we have proven that these AI tools in these specific tasks are as good as that. So.
Thank you very much, Hermano. Stochastic parrots, I like that. Bruno, would you like to go ahead with the next one?
Yeah. Well, we have a question from the attendee. I hope I spelled the name properly, Heptizan Saleh. And the colleague has a concern about using AI in evidence-based research, specifically on addiction topics, that they might lead to oversimplification of a complex and heterogeneous topic. So where the colleague says that addiction is a multifaceted issue and highly sensitive to language, culture, and legalizations across countries. And his question refers to how can AI handle new data based on new substances and behaviors among diverse populations. So it's a question about how do you deal about something which is quite heterogeneous and you have different populations, and how can AI handle this data? Vivianne, Hermano, who wants to give it a try?
Well, I mean, I think it speaks to getting the question right. I think there's an opportunity for machine learning and artificial intelligence to actually support systematic reviews on more complex questions, because some people I work with have said you can actually search much broader and wider set of articles when you have machine learning to support the screening of those articles, as long as you define the question well. So I think, there's an opportunity that machine learning, artificial intelligence gives people the time, more time and space to define the questions and how they will interpret and analyze the data, right? But I totally agree there is a risk of oversimplification, which, as I mentioned, I think we really need to develop the use cases and test how machine learning is working in these kinds of complex social questions. Yeah. I'm with Hermano that it works, but I think we need to convince people.
Yeah, exactly.
Indeed.
Brenda, do you want to add anything?
No, I can only guess the complexity of the area in which we are working. So we work in food and feed safety, so it is a different areas. We also have the problems that some areas the population are not covered usually by the evidence we find. Typically, for example, toddlers, because they are not able to report the data on what they eat. The only people that could do that are their mothers, but they are already so busy that they don't have time to report those kind of data. So yeah, but I can understand your domain can be also much more complex. The only point I can add about oversimplification is that from what I see, EFSA is often asked to simplify the message from the public, no, because we public scientific opinions that are maybe 160 pages, totally ununderstandable and unreadable by the public, by the general public. And the general public, at the end of the day, they only want to know what they can eat and what they cannot eat, and in which quantity they can eat it or not. So at the end, it is a matter of simplification. I think your Alexis want to comment.
Thank you, Hermano. I think Alexis wants to also.
Yes, I wanted to thank you for your presentation. I have a comment that is also kind of a question. Is from what I read here and there, and from what you said, I have the impression that, the two things I wanted to share and have your opinion. The first is obviously the artificial. I like very much the definition that Hermano gave to artificial intelligence, because I think there is a lot of fantasies about what artificial intelligence really is. And especially among those who don't know what it is, including ourselves. So we have a tendency to imagine that, oh yes, with artificial intelligence, we will do magic things. But I think to some extent, what it shows, and that's my second comment, I like very much what was said by Vivianne, because I think basically the risk of oversimplification is clearly and permanently associated to any of our scientific work. Every time we present data, every time we communicate our reports, there is a risk of oversimplification for those who read us. Just the difference between, look at the difference between our reports or press releases and what is sometimes reflected by some journalists or some people on the media who are not journalists, but they're over simplifying frequently. We have also the challenge that sometimes some of our customers, sometimes again, journalists or decision makers, they want clear answers. They want simple answers. And for instance, one of the things it happened frequently to me over all those years I'm working at the agency is how many times we need to say, no, look, it's not as simple like that. Look, it's just about some statistics who tell us how many people. It doesn't explain why. It doesn't explain how. So we need to be careful about the conclusions that we can draw. So I think to some extent, I have the impression that AI, there is always a potential risk to amplify this bias, but it's permanently, it's part of our permanent life and experience. And then I think that it shows that it's even more important to ensure training, education, a bit like they did in Finland. I followed a very interesting course from the University of Helsinki, because myself, I did not know what we were talking about. And some years ago, they launched a program because the government of Finland realized that learning the experience from Nokia, if they wanted Finland to have a future in the industry, they decided that they should target everything that is for startups, artificial intelligence, and so on. But then they decided that they identified that there was a need to give a basic education to citizens about what it is, if they wanted them to support the project for the society, for the Finnish economy. And it gave birth to the training program Elements of AI from the Helsinki University. And I think it's a brand new area of education and permanent education for all of us, because at the end of the day, what AI shows, it's really not magic, is that the essence of statistics is to make sure you are clear about what is the right question and what is the right hypothesis. And we have a growing tendency to forget that, as I was told by our professor of statistics at the university, in the best case scenario, your statistical analysis will give you the confirmation that your hypothesis is not wrong. And I think everything we extrapolate goes sometimes far beyond that and far beyond what we could reasonably expect and pretend to say or draw as a conclusion. And my last comment is when we mentioned about the biases, even if I imagine this is not something you at EFSA or at Campbell are confronted with, I think what I find really interesting and a potential risk is the fact that we have too many white males drafting all those programs and the algorithms, and that there is a huge risk for diversity, for also gender equality, but also the fact that some very intelligent program, even in cars with autonomous driving, they recognize more easily white people that are crossing the street than the others. I think it's a very strong illustration that more than ever we need better education, better control, and to be better self-critical about what are the questions we want to ask and to which we want to ask the help of artificial intelligence. But artificial intelligence can only help and can help us to go faster. And I think we should not ask AI to do the things that are typically human. I think it can be extremely useful. We see the work of Campbell or EFSA for the huge quantities of data and text that it would take hours and days and weeks for a human being to read and to take note. But the conceptual work, it remains human, and we need to be aware and we need to stick to that.
Okay, thank you, Alexis. Greg, you have the next question.
Thank you, Bruno. So the next question we have is from Astrid from the Flemish Peace Institute, and it's related to human intervention. She mentions that they recently launched their own AI tool, gunviolence.eu, which uses machine learning to provide an overview of firearms incidents in the European Union based on local media sources. One of the main findings that they realized is that human intervention is essential, especially to ensure a reliable and valid tool. The question is, how do you ensure the reliability and validity of your tools in your case?
Well, I can answer from the EFSA point of view. We have a validation phase, of course, before we introduce the tool into production, into the normal usage, and it is a challenge. That also is a challenge, especially if you ask AI to do complex tasks. The answer is complex, and the validation also is complex, no? So to test the validity of the tool for screening by abstract and title, for example, as I explained a bit before, we have taken a number of evaluations that had been done by EFSA in the past, and we asked the AI tool to repeat them, and we have compared the result with what our scientific experts have done. That's how we discovered there is this 70%. There was this 70% agreement between experts. Also now with the critical appraisal tool, we are using the evaluation of critical appraisal done in the past by EFSA scientific experts as the validation base for the tools. And but again, we are discovering that oftentimes in the past, the experts had a discrepancy in their evaluation. We could say that oftentimes the absolute truth does not exist. So the different experts at different point of view is something we want to preserve. Anyway, in the case of the critical appraisal tool, the final evaluation confirmation of the risk of bias will be given by a scientific expert. The tool will only provide all the evidences, all the facts in the text, and will give an estimation, but the final evaluation will be done by our scientific experts, at least in the initial phase. that we want to have scientific experts, human scientific experts, always in the lead.
Yes, Hermano, I think it's a key feature, no, to always have human supervision. It's essential. Vivianne, I don't know if you would like to answer anything this question. We move ahead. What do you think?
No, I totally agree that it's validation with human data. I think the validation is a little bit different depending on the task that you're validating the AI or machine learning. So, you know, with screening, it's what Hermano already mentioned, sensitivity and specificity. With critical appraisal or data collection, then it's really accuracy, you know, how many errors are made. Like I said, I've seen many case studies of applying machine learning or artificial intelligence to developing, you know, lists of included studies, so characteristics of participants and interventions, and verifying the accuracy of that. I totally agree with you, Gregorio. You need a human in the loop, although humans are fallible as well. And one of the things we are testing, we hope to be testing with in partnership with Cochrane is, you know, can AI and machine learning actually better collect information about participant characteristics like ethnicity and race, which might be difficult for humans to pick up. So I think there's lots of work to be done. Yeah.
Bruno, would you like to go ahead?
Yeah, thank you. Well, before I go to the next question, I would like to thank you for the question from Arstid from the Flemish Peace Institute. I've personally looked into the gunviolence.eu platform that you have. It's quite impressive the work that you have done in screening through the news of I think it's over 300 sources of information, and it's really a very good example of how you can use AI for a very timely getting information quite timely on a specific topic, in this case on gun violence. I have now a question from Napoleon, and I hope I spelled it properly, Papa Giorgio, where and maybe this is already focusing a bit on a very specific area, but let's see how it goes. What is your opinion about machine learning based prediction procedures on addiction treatment results? There are some papers indicating such option, mostly in pharmacology, but it could be a general model. Maybe it's a bit scary, but maybe it could be helpful. Vivianne, Hermano, and then yeah.
I think this is more Vivianne domains. No?
Well, I was going to say, I think, you know, this is an application of machine learning to treatment results that I think a little bit what Alexis said about defining your questions and that conceptual thinking about, you know, when you do systematic review about treatments and interventions, will you include prediction models, and how will you include them and assess them, is a little bit about the new world of defining, you know, what are the right questions and how do we evaluate them. We need the humans and the conceptual thinking, I think, to decide that.
Now, if it can be of help in our area of food and feed safety, but also on the pharmaceutical sectors, there is a lot of usage of AI in predicting toxicity of new drugs, even starting at the molecular level. No? And one of my colleagues that now works at Johns Hopkins has demonstrated very good results in predicting toxicity of drugs. The reason why a lot of people are in favor of that is that testing toxicity of drugs anyway involves animal testing. No, so being able to predict toxicity of new drugs starting at a molecular level without having involving animal testing would be a benefit for the planet in general, for mankind and the planet in general. So that's an area where there is a lot of interest in predictions generated by AI. A big question mark that EFSA, but also EMEA has, is that our current regulations are not always prepared for taking into consideration predictions generated by AI. There are some regulations that mandate the usage of animal testing, even the usage of human testing. But so the point here is how we will be able to change the regulations to be able to use predictions generated by AI. But there are very promising results on that. That's the best contribution I can give to this question, which is not really my domain.
Yeah, this is a very interesting point. And I think the creators of ChatGPT, in ChatGPT at the beginning, maybe the third one, they published a paper where they used an example in which they asked the AI to do some drug elucidation. Basically, they asked the AI from all the drugs currently used for, I don't know, it was, I think, diabetes, search the patents and understand what is going on in the patents and propose a substance that is not yet in a patent and contact a laboratory for producing the substance. And this is a step in the pharmaceutical industry that takes a long time. And of course, the AI might not be perfect. It was just an example, but it was an example that took 5 minutes to run. And the AI produced a wide range of molecules that potentially could be of use. And then, well, the human supervision, of course, the pharmaceutical or the pharmacist would just check the substances proposed by the AI, but it was an amazing example. And this was 1 year ago or something like this. So yeah, very interesting to see that. If that's okay, I will go ahead with the next question. I'm mindful of the time. We have 2 more questions for now, so I think we're doing okay. The next question is from Alexander Saverio Bachman. It goes to both of you, to Hermano and Vivian. The question is, do you agree that it would be wiser and more efficient to use AI as a tool rather than as a baseline operating mechanism for any upcoming issue for immediate answers? The question itself is, are you not afraid of data corruption or misuse of meta-analysis?
Yeah, well, if I can answer for my part, yes, AI today is the way we use it in EFSA, at least, is that it is a tool, and we are not using it to take autonomous decisions. No, there is always human supervisions at the end of the process. Yes.
I agree. And Campbell, it's the same, that AI is being used as a tool in different steps of reviews, but always with humans in the loop.
I think this is a key feature, right, that we highlight today. So Bruno, maybe...
Yeah. Okay, so I think that we are heading quite fast towards the end. So I have a question which relates to the intervention of Alexis and in relation to the Finnish training from Roberto Molica, where Roberto is saying that it seems that AI can be used or purchased using a simple request, but AI works only if it is fed by a great amount of verified data, which is correct. What do you think about employees' education of digital and technological tools? They are not aware about advantages brought by innovation. I think that there is a need for reconverting and for improvement. Vivianne, maybe start, and then Nano, if you can add.
Yeah, well, I think, you know, the use of these tools has to be in our training for systematic review contributors, because, you know, some tools are at the point where, you know, they should always be used. I think priority screening for systematic reviews should almost always be used, you know, with a human in the loop, that you are not cutting off the tail, but they reduce the workload by 30 to 50%, and they're effective. But we need to train systematic reviewers. But I think we also need the funding to build the tools that are meeting the needs of doing systematic reviews, and packaged in a way that they work well for evidence synthesis. So as Hermano said, you know, they've developed their own tool because there wasn't something available. But you know, we don't want every systematic review author to develop their own tool. We'd like to see validated tools that are available for systematic review authors to use, and that have been proven to work, you know, with validation sets and training sets and so on. So I think training for reviewers, yes, but we also need the tools to be developed in a user-friendly way.
Now, what I see, if I understand the question, is about the adoption of AI and how our colleagues are willing to do it or not. No, just to be a bit provocative at the end, I sometimes see in EFSA the opposite situation, no, where me and my team have to stop some people from using too much ChatGPT or GPT-4, and it's not only because they have read it on the New York Times on the weekend, but because they have started using it and they find it works, and they say, they become addicted to it, no? So they would like to use it every day. So we have started explaining them the ethical rules from the Commission of the usage of large language models, and what are the risks, infringing copyrights, for example, of not uploading confidential information there. So I'm not so convinced that there will be resistance in adoption of AI. Sometimes I also see even too much enthusiasm, but this is just my point of view. And this is also what we were discussing in the UAI virtual community. You tend to become addicted. No, you see that you push a button and the ChatGPT does the work for you. You also have to reflect a bit on what ChatGPT has concluded. I think you always have to remain in the lead.
Indeed,
that's my
Hermano.
point of view.
This is very interesting. I compare this phenomenon of AI a little bit to the digitalization process in the workplace when we started to use computers, or even when internet came and everybody started to use internet. It's this kind of change. There's some resistance. There's also some early adopters that love it, you know. So we're just crossing the horizon in this respect. So I am mindful of the time. We had some more questions, but unfortunately we don't have time to answer them. I will pass now the floor to Marika. Marika, please, the floor is all yours. Thank you.
Thank you. I don't know if Alexis wants to say some conclusive words. I think I'm proud of having involved two colleagues who have experience in artificial intelligence, but not in our drugs-related field. Or yes, Vivianne, because they have a group, a specific group, but I think it's the way we need to go ahead by involving colleagues from different areas to have a shared discussion and exchange of experiences, because of course we will make trial and errors. This is in the history of any new technology, but it's important we open up and we learn from other experiences. So I really thank you to both of you, to both the speakers, to the excellent chairs of this session, Alexis for being always present and supporting our innovative approaches. I thank everybody. We will launch a small poll for our audience to express their opinion, but no need for the speakers to remain if you need to do something else. So thank you very much, and see you in our next webinar. Thank you.